Hello and welcome back to my channel. Are you a male and you experience pain while urinating, or you experience pain during sex? Stay tuned for more. I'm your favorite medical microbiologist, Gwendolyn Halley. Let's go there. Welcome back. Today we'll be talking about urinary tract infections in men or males. What are urinary infections? Urinary infections are infections that affect the urinary tract in a male, particularly the urethra. What are the causes, or what are some causes of urinary tract infections in male? Point number 1, bacterial infections. Number 2, sexually transmitted diseases. Number 3, HIV/AIDS, that's a human immunodeficiency virus. Number 4, enlarged prostate or inflamed prostate, and we are talking about cancer in this case. Next point, if there have been any previous surgery around the pelvis, and if it has been related to the urethra or the tine of the urethra. And the final point is if you are wearing a catheter, or if you have worn a catheter. A catheter is a little device that is medical device that is being passed through the urethra of a male from the opening of his penis to the bladder. So these are some causes of why some males may have urinary tract infections. We have often heard of urinary tract infections in females than in male. That's because the urinary tract of a female is shorter than that of a male. So it's easier for a woman to experience the primary symptoms much earlier than a male. What are the symptoms of urinary tract infection in male? Now, this may vary from man to man, and the symptoms may occur in primary stages and in later stages, depending on the individual. The first symptom is cloudy urine. Next, blood in urine. Some men experience blood in urine. Pain during sex. Pain while urinating. Frequent urination. Pain in the lower abdomen. Pain in the upper urinary tract area. Some men experience fever. They feel malaise. Some may have chills. Some may get nauseated. Now, how can you treat these urinary tract infections? The first thing I have to say, when you notice or you experience any of these symptoms I have mentioned, please go see a doctor. This is not a case where you can go to your pharmacist and just ask for a drug or an antibiotic to take, because not all urinary tract infections in male are caused by bacteria, because we use antibiotics to kill bacteria. So when you go see your doctor, you're going to do a urinalysis exam. A urinalysis exam is where a sample of your urine is going to be taken, and it's going to be tested. The pH is going to be tested, and part of that urine that has been given, a sample of that urine, will be taken for examination, culture examination. It will be cultured on the specific mediums, and then an antibiogram may be used. Also, you do a test to test for sexually transmitted diseases, including HIV/AIDS, that I should say. And if you are a male of 35 plus, because some males start having prostate problems from 35, it varies. If you're a male from 40 plus, the doctor is going to inspect you, to examine you, to see if you have any prostate issues, if your prostates are enlarged, if they are inflamed, and a lot more. Now, how can you prevent sexually transmitted disease? Point number 1, please protect yourself. If you cannot abstain, which I'm for abstinence, please protect yourself using a condom. And also on the female, insist she uses female condoms. Protect yourself. I mean, condoms are not 100% effective, but at least you get some level of protection for yourself. The next point that I'm going to give for prevention is make sure you take your antibiotics after any surgery that you have had related to your urethra or around your pelvic area. Make sure you take the antibiotics right for the amount of days that the doctor has requested. Don't decide that, okay, today I think I feel better. I think the side effects of the medication, it's not going for me, and I think that I can be without it. Take the medication for the amount of days the doctor has prescribed for. Don't take less, even if you are not experiencing any form of symptoms. The next point is, make sure if you are a male that is 40 years plus, make sure you go for your trimester examination, prostate examination, so that your prostate may be monitored. Your prostate may be monitored, and you may be given early treatments or treatments to prevent you from having prostate cancer or BPH. I don't know if you have any questions while watching this video. Please pop them down below. If you are a returning subscriber, I would love to say thank you, thank you, thank you. I am very happy and grateful to have you in my family, in this family. And if you are not subscribed, or if you found yourself on this channel, if you have not subscribed, please subscribe, like, and share to those whom this information will be of great use. Thank you. Till next time, I'm your favorite medical microbiologist, Gwendolyn Halley. Bye-bye.